Hi, friends. It's Beth here with Aging Care Solutions. Welcome back. As you know, I'm offering both professional and personal guidance and experience for caregivers, seniors, family members who are caring for their loved ones as we all travel this journey called life. So I'm happy you're here. And thanks for coming back to find out what am I talking about today? What is she talking about? Well, today I wanted to talk about. I had a conversation with a friend recently. She is a home health specialist, so she works for a hospital system providing care to patients who are going to subacute rehab, so a short term rehab facility. Um, and basically, what she said, one of the biggest things that's been taking place recently is that people are packing up their stuff and they're leaving. So they're going AMA, which is against medical advice, after they've had a hospital stay, which typically that's about the only reason that you're there is that there's been a 3 night overnight stay and they deemed that your condition, whether it was an infection or you had a fall resulting in injury, or maybe you have a chronic illness and you had a decline in your health, something was going on, maybe you fell, and it brought you to the hospital and they assessed you and they deemed that your injuries or your condition would result in admission to that hospital, not observation, but admission. And many people, if it can't be a safe discharge, when they are planning that person's discharge from the hospital, maybe you don't have any children, maybe you don't have a spouse, maybe you're going home on your own, and they're deeming that an unsafe discharge. So they're going to send you while you're still recovering from the infection or your injuries or your condition until it stabilizes. They're going to likely recommend that you go to a rehab facility. Now, some of them are great and some of them aren't great. And you don't have to take the first place that they recommend to you either. So if you have a friend and they've been to rehab after a hip replacement or whatever, I would do just a little bit of legwork. Get your smartphone out and say, Google it and say the best rehabs near me or the best inpatient rehab facilities in my area. And you could find out, say, what places are you thinking of referring me to? And they'll give you a list of 3 or 4 places and they have to see if they have a bed available. And you can look at them. You can Google them and you can open it up and you can see what their star rating is. And you can say, I don't want to go there. So I don't care that they have a bed. I want to go to this one because their outcomes are better. You're going to have to be your own advocate. So many times families were said, I've been driving to so-and-so. It takes me about an hour from where my mom lived or where my dad lives to see them as they recover. And I said, why did you choose? Why did they give you that one? They're like, they said that one had an available bed. And I said, they could have probably held your parent one more day or a few more hours, and you could have gotten a place that's 10 minutes from their house. So many times people are assuming that whatever they're being told is the exact thing that they need to follow. But ask as many questions as you can, especially if you're your own advocate, you don't have somebody else. You could talk to the social worker or the discharge planner and say, are these my only options? Is there any place that's better? And if you find that there's a place that's better and they're further from where where you live, but you're going to get a better outcome and you're going to have a more comfortable place. Some of these places are gorgeous. Other times they're hellholes. So I'm just telling you, you can very much decide on your own. And that's why I think a lot of people are leaving. They're getting into a place where they are being ignored when they hit their nursing bell. Maybe they're not getting the level of care that they want or they thought they were going to be getting. A lot of times the work is hard, especially if you're in pain, if you've had, a bad infection or you're really weak. Oh my gosh, I have seen people where, especially if you're older, it's like these infections, especially if you get pneumonia really bad or people who are getting COVID, it can really take it out of you and it can take weeks to get your strength back. So I would just say, do everything that you can to know and also encourage yourself on a daily basis that my body's getting stronger. I'm feeling better. I'm going to do the work that's required of me. Make sure you're hydrating, even though it's going to be a pain to have somebody help you up into the restroom. You just have to do everything that you can to let yourself know I'm going to get back to my strength. I'm going to get back to full strength as I do the work that's here. But what people don't understand when they go AMA, a couple things can happen. First of all, if you're leaving a rehab facility, they'll cover, your insurance provider will cover the days that you were there and whatever services you had while you were there. Of course, they're not going to cover it when you leave. They're not going to refuse to pay, but it could increase your out-of-pocket costs in the future. And not only that, it could mean that you could just readmit. I mean, I cannot tell you how many people leave and within 30 days they are back at the hospital, back at the rehab because they didn't stay long enough. Now, the insurance providers have a lot to do with that, especially if somebody is showing, it's kind of a double-edged sword. If you're showing progressive improvement, then they're going to cover your stay. If you reach a plateau and you show no improvement, they're kicking you out. So it's sort of I don't know, somebody's winning, and I think it's the insurance providers that are winning. But if you're going home and it's not a safe discharge, there's a couple of things that could happen. There's no RX written for you, so you don't go home with whatever new prescriptions that you were put on for your infection, or if they adjusted your blood pressure medications, or if you had something else introduced during your hospital stay. There's no doctor's orders for any home health. So you've missed that because you packed up your stuff and you had your neighbor come and pick you up, or your husband came and picked you up, or whoever. So what you should do is tell them, give them a heads up and say, I'm leaving within 24 hours or 48 hours. I mean, give them at least a day or two to at least get everything that they can prepared for you. They'll get orders written so that you can get a home health consult, so that when you do get home, you are still getting your physical therapy, occupational therapy, wound care, nurse visit, whatever it is that you needed that brought you to that rehab before you decided to split. And you want to make sure, I would just give them the notice. That's what my notes are telling me again. And don't be surprised if your infection isn't cleared up and you weren't getting nursing care because you left. If you don't get home health, the odds are pretty good that you're going to readmit, and you really don't want that. Nobody wants to go to the hospital. Nobody wants to go to rehab. But the fact of the matter is, if you can't go home safely, you're just going to be in this loop. Hospital, rehab, home, hospital, rehab, home. So, my best advice is stay on top of your health if you can. I mean, really just feeding your body the right way, hydrating, the movement that we talk about so much, keeping your body as strong as you can. But if you're leaving against medical advice, be prepared for to be missing a few things at your exit. And that is orders that you might need, prescriptions that you might need, and advice from the doctor who's managing the patients at that community. And also don't forget that you can also, there's choices that you're going to have when you are making those decisions as you're getting released from a hospital. You can have as much input. You could tell them, this is where I live. I live in this particular area. I'd like to see what are the top 3 places in that area. And then you make your decision from there. So I hope this was helpful. I know that a lot of times families are in crisis and they don't, their kids live at a great distance. So it's not always, feasible to have anybody there to pick you up. And a lot of people, I've been to people's homes to feed their cats. I've adopted people's pets because they couldn't care for them anymore. I've helped people move into assisted livings because they couldn't stay home anymore. There's a lot of different things that over the years, trying to help people make good decisions, good sound decisions. And I would say, if you were my parent, this is what I would advise. And a couple times I would tell people, if you were my dad, I'd be so mad at you right now. And they're like, what? They don't listen, right? They're like, I said, you shouldn't be driving. You shouldn't be driving. You're not, you're not well enough. You had a stroke. You shouldn't be, until you've gotten the level of clearance. I just feel like over the years I've helped, and I've also at the same time just kind of worried about a lot of people over the years. So, all right. Well, again, I hope this was helpful. Please feel free to share any information, any topics, anything that you're facing right now as a senior, or if you're caring for a loved one in your family. I want to be able to help. I want to be able to bring you relevant information, things that all of us, nobody tells you when you start getting older, some of the things that you're going to face. But being prepared, having kind of sort of some plan of action, and that's what I would tell families. There's always a solution. Let's find the best one for you, and then we'll roll it out. So I'm here for you. Feel free to message me, and I look forward to seeing you at the next video. Take care.